Every week I get asked some of the same dental questions, but here's the problem. Most people are worried about the wrong stuff. So in this video, I'm gonna answer some of the most common questions I get from patients. So chances are, if you're watching this, you might have wondered one of these things too. The first question I wanna answer is, what is the best toothpaste to use? So many people ask me this. It's like this big toothpaste obsession. And my answer usually surprises them. Your toothpaste doesn't really matter. At least not as much as you think it does. Most of the cleaning on your teeth can simply be done with your toothbrush and just plain water. Your toothpaste is just an added bonus, and most toothpastes have things like abrasive things in there which help kind of polish and clean your teeth, but also remineralizing things that can help strengthen your teeth. But you don't technically have to use toothpaste. Now obviously I still recommend you use it because it can only help if you use toothpaste. But if you understand that, then you'll understand that most toothpastes don't really matter. Most of them do the same exact thing. So rather than looking at the different brands for different toothpastes like Crest versus Colgate, make sure you're doing the right things first, like brushing a full 2 minutes every single time. Make sure you're also flossing your teeth. Those two things are gonna be way more important. Now, if you wanna know what brand I like to use, I personally like to use Colgate with stannous fluoride. The reason I like Colgate is it's a little less abrasive than the Crest toothpaste, for example, meaning it won't polish your teeth as much. Sometimes I think you can kind of over polish your teeth, and that's how your teeth end up getting weaker. That's how you lose that enamel, and your teeth can end up being more yellow over time. And if you wanna know why I like stannous fluoride over the other types of fluoride, I made another video talking about the different types of fluoride in your toothpaste. So make sure you check out the links in the description below where you can learn more about that. But to keep it simple, stannous fluoride is like the best thing we can have in our toothpaste. It helps protect our teeth, it makes our teeth stronger. It also helps protect our gums and makes our gums cleaner. Now, some people ask me about hydroxyapatite toothpaste or like xylitol toothpaste. I'll quickly touch on that. Hydroxyapatite is fine, but it's simply not gonna work as good as fluoride. So for me, I'd rather use something that is tried and trusted, that has been proven to be safe and has been proven to work the best. So that's why I like fluoride to help strengthen my teeth. Now, hydroxyapatite, on the other hand, is similar to fluoride. It'll still help strengthen our teeth. It just won't make our teeth as strong as if we use fluoride. Now, the reason that people use hydroxyapatite is because there's been a lot of controversy with fluoride. People like RFK and other TikTokers are coming out and saying that fluoride is a neurotoxin, and people have been saying this for many years. There's been a lot of claims behind this. I'll quickly touch on this because I did talk about it in many other videos too, but fluoride, just like any other sort of medicine or ingredient, can be harmful. It just depends on the dosage. So if you look at studies where people are taking way too much fluoride, obviously there could be a correlation with some sort of problems. But in the concentration that's in our toothpaste, in our water, etc., it is extremely safe. There has been nothing that shows it can cause any harm. And there has been almost 100 years of research behind it. So we have the long-term studies and we know that it works. So I don't really see the controversy here. But if you're gonna use a hydroxyapatite toothpaste anyway, just know that it has to be nano-sized hydroxyapatite. Sometimes these toothpaste companies will try to scam you and they'll make like a micro-sized hydroxyapatite toothpaste. Basically, that's the size of the particles. In order for it to work and actually strengthen your teeth, it needs to be nano-sized particles. And on top of that, most studies show that you need at least 10% hydroxyapatite in the toothpaste. Most toothpaste companies do not include that at 10%. Now, there are a couple studies showing that you can get the same benefit with a lower concentration of hydroxyapatite, but I would recommend looking for something that has 10% and nano-sized particles. And a few people ask me about xylitol toothpaste. Xylitol is just an ingredient like a sugar substitute sweetener. So xylitol is not gonna strengthen or remineralize your teeth whatsoever. The cool thing about xylitol though is that it's an antibacterial, meaning it can actually help prevent cavities because the bacteria in your mouth that cause cavities, when they eat xylitol, they actually die. Now, this is the only sugar substitute that actually prevents cavities. So that's the cool thing about xylitol. That's why I like xylitol chewing gum or xylitol mints and xylitol in your toothpaste. But xylitol alone is not going to strengthen your teeth. That's the difference. It's not gonna actually remineralize your teeth like the fluoride and hydroxyapatite. It's only gonna help prevent cavities. So if you combine xylitol with this fluoride or with this hydroxyapatite, that, in my opinion, is a perfect toothpaste. Now, if you want more details on the different types of toothpaste in general, I made another video and I'm putting that in the description below as well. Now, the second question I get is, should I be using mouthwash or some sort of question about mouthwash? I think a common theme among these questions is people want something that's like a quick fix or something like some magic ingredient that's gonna fix all of their dental problems. The truth is, most mouthwashes are kind of useless. If you're brushing and flossing every single day and doing the right things, there's a good chance you don't need to use any sort of mouthwash. And the thing is, mouthwash is never going to replace brushing or flossing. Those two things are always going to be like the grade A tier, or what people call like the S tier. Now, some mouthwashes can actually make your mouth worse and actually throw like the bacteria in your mouth out of balance. So one mouthwash I would avoid is alcohol mouthwash. Any type of mouthwash that has alcohol in it, I would not touch because it's going to dry out your tissues, and your saliva is so important. That's like one of the most important things to keep your teeth clean and healthy. And people that have a dry mouth are way more prone to getting cavities and gum disease. So if you use a mouthwash with alcohol, that's gonna make you more prone to having a dry mouth. So don't use that. If you want to use a different type of mouthwash in addition to brushing and flossing, that's totally fine. But the timing with this also matters, because if you use a mouthwash right after you brush and floss, then you're going to be washing away the fluoride that's on your teeth, or the hydroxyapatite that's on your teeth that's supposed to be remineralizing your teeth. So instead, in that instance, it might be better to use a mouthwash first. Now, if you have a fluoride mouthwash, that's something you can just do like in the middle of the day at a random time, just in addition to your brushing and flossing to help keep your teeth strong. But again, it's not something that you need to do. Now, the third question I get is, why does my breath smell even if I brush? Now, this is a good question because a lot of people struggle with this. And the truth is, there's a lot of things that could be going on that could cause bad breath. I'll touch on a few. The first one is if you're not flossing. So when you don't floss, you're not cleaning in between your teeth, you're not cleaning underneath your gums, and this allows bacteria to lie underneath your teeth and stay underneath your gums, and they will just keep building up and causing inflammation. When you have these inflamed gums, or in other words, gum disease, what people also call gingivitis, then your breath is gonna be way more prone to smell bad. Another thing you could be neglecting is brushing your tongue. Your tongue is like the breeding ground for bad smelling bacteria. So simply using a tongue scraper, something you can get from like Amazon or Walmart, super cheap, just like a metal piece, or like sometimes they have plastic ones, but I'd recommend a metal one, something that literally scrapes from the back to the front of your tongue. Do that a few times, and then you'll see all this gunk that comes off your tongue, and then rinse it off in your sink. I've had so many people tell me that once they started doing this, that their breath instantly got so much better. You could also have tonsil stones. Tonsil stones are like these clusters of bacteria that kind of get hardened, but they hang on to the back of your throat area, or like in your tonsil area. So if you open your mouth in the mirror and say, ah, and you see these like white little specks on the back of your throat or around your tonsils, these are called tonsil stones. Now, usually these are pretty simple to remove. Sometimes you can take like the back of a really long Q-tip and just poke them out. Sometimes you can get this like attachment to this water flosser and put it at a really low setting and then shoot it at those tonsil stones to get those out. But most of the time, tonsil stones come from not brushing and flossing correctly. But there's a lot of different reasons that tonsil stones can come. And I made another video on this topic, so I hate to bombard you with other videos, but it's easier just to link you somewhere else so you can learn more about it. So check out the description below if you want to learn more about tonsil stones. But those different gadgets to remove those tonsil stones are a quick way to get rid of that bad breath, because tonsil stones do not smell good. Now, you can also get bad breath if you have a dry mouth. Those two things kind of go hand in hand, because when you don't have enough saliva, then you're gonna have all these bacteria in your mouth and your mouth's just not gonna smell good. You know, like when you have that morning breath and your mouth's been super dry and you go, oh my God, super smelly. That's from having a really dry mouth. So there's a couple things you can do. One, if it's a morning breath problem, obviously like if you brush and like scrape your tongue the next morning, that bad breath should go away. But there's a good chance if you wake up and there's like drool on your pillow or the side of your face and your mouth is super dry and it smells really bad, there's a good chance that you've been breathing in and out of your mouth all night long. Now, when you breathe in and out of your mouth as opposed to your nose, then you're more likely to have a dry mouth. Now, there are a ton of other problems that can come from mouth breathing as well. You're more likely to have sleep apnea, you're more likely to snore, you're more likely to just not sleep as good in general and just not be as alert the next day. Your body's not gonna get as much oxygen. So learning how to breathe in and out of your nose is gonna help benefit you in so many other ways. But from just a dental mouth perspective alone, when you have a dry mouth, you're not only going to have a smelly breath, you're also going to be more likely to have cavities and gum disease. So that's where nose breathing helps so much, at least just when it comes to your oral health. So one thing you can do is use a mouth tape. Literally just a medical grade tape. You rip off a piece and then tape it over your lips. The tape that I like to use is something called 3M micropore paper tape. You can get it on Amazon and it's super cheap. You just need a little piece that's going to help encourage your lips to stay closed, because when your lips stay closed, then your body's encouraged to breathe in and out of your nose. You don't want to tape it so you're basically forced to keep your mouth mouth shut. You just want to resist it, and if you have to breathe through your mouth, you still can. So if you don't have a beard and a mustache like I do, you can tape it vertically. I have to tape it horizontally so I don't tape my beard and my mustache. You can also use like a nasal dilator strip, literally like a strip that goes over your nose. It helps dilate your nose, and that's going to help you breathe through your nose as well. Now, if you cannot breathe in and out of your nose, or your nose is always stuffy, then I made another video that kind of goes into detail on this topic and how you can basically unclog your nose. So check out that video in the description below if you want to learn about that. But if you tried all of these things and you still have bad breath and you can't figure it out, try going to your doctor and also your dentist, because there might be something else that's going on. Like there might be something in your health that's causing problems with your breath, or something else with your mouth that you might not even know about. The next question I get a lot is, why do I need a crown instead of a filling? So if you don't know what this is, a filling is basically when you have a cavity in a tooth. A cavity is a hole with bacteria inside of your teeth. So when you do a filling, you have to drill and fill. So you basically have to drill out that cavity, make this hole in the tooth, and then fill it with some sort of material. Now, a crown is done when, instead of doing that, you basically shave the whole tooth down, remove like 1 millimeter to 2 millimeters, all the way around 360 degrees around the tooth. And then you put what's usually a ceramic material around the whole tooth and you cement it on. So it's basically like a helmet that goes over the tooth. The answer for why you need one over the other is actually pretty simple. Once a filling will get too big, or the structure of the tooth is not strong enough to hold on to just a filling, then you need to do a crown. Because let's say you have a giant filling, like the whole tooth has turned into this filling, then there's a good chance that tooth will break. And when teeth break, they break really unpredictably. You could break into the root, you could break into the nerve, and if this happens, you might need a much more involved procedure, or you might need to lose that tooth entirely. So the crown is done when a tooth is at this point to basically prevent it from breaking. Now, the fifth question I get a lot is about dental x-rays. Why are they necessary? Are they safe? Why are you taking so many x-rays? It would be impossible to do my job without having adequate x-rays. It would be like going to the grocery store and let's say you have to make guacamole tonight. You are going in blind picking those avocados. You don't get to feel them, you don't get to touch them, you just have to go in and grab them with a blindfold on. You don't know if the avocado has mold on it, you don't know if the avocado's ripe or not, and you have to make that guac tonight. That sounds pretty daunting, unless you're an avocado expert. Modern x-rays use extremely low radiation, even less than like a short flight or eating bananas. There's a fun fact, bananas naturally have radiation. And one dental x-ray equals about 50 bananas of radiation. So you might think like, hey, I'm not eating 50 bananas. But you're only getting x-rays once a year typically. Versus bananas, people could be eating them every single day. I know people that eat 2 bananas every single day. I eat a banana a day. The point is, if we're comparing dental x-rays to bananas, we know that both of them are extremely minimal. The ADA even came out recently and said that we don't even need to use that lead vest anymore to help protect patients when we're doing dental x-rays, because the radiation is so low that we just don't need it anymore. There's no evidence that they have to justify the need for that lead vest. That lead vest is so simple to put on. And if the ADA is saying that you don't even need to use that because of how safe dental x-rays are, then we know that they're safe. And the risk of missing something by not taking x-rays is way higher than the risk of any complications from dental x-rays. I can't tell you the amount of times I've caught something suspicious, like infections, bone loss, or decay on a patient before they even had any sort of symptoms. And if it hadn't been for that x-ray, we never would have caught it until it became way later and a much bigger problem. So if a patient comes to me and says they never want to get x-rays, honestly, I refuse to treat them. I tell them this is not the practice for you because I cannot do my job properly. The sixth and the last question I want to talk about in this video is, how long do fillings last? Or how long does dental work last? This is a hard question to answer because it really just depends on the situation. Sometimes a filling can be super minimal and in a perfect location, and the patient's habits are perfect, they're brushing and flossing perfectly, and I'm confident that this filling could last forever. Sometimes I do a procedure on a patient and I know that they're not going to listen to any of my instructions, and I'm not confident how long that procedure is going to last. The thing is, in dentistry, nothing is meant to last forever. Everything we do is a replacement for your teeth. Your filling is a replacement for that tooth structure that used to be there. A crown is just even more of a replacement. An implant or like denture are a replacement for not having teeth. That's the difference. They're not a replacement for teeth. They are a replacement for no teeth. So nothing is going to be as good as your natural teeth. Unfortunately, in dentistry, most studies do not go past 10 years in terms of how long things last. So that includes crowns, fillings, implants, etc. Most things that we do, though, have a really high success rate after 10 years, like a 90 to 95% success rate. So in dentistry, they say that if something lasts that long at that high of a success rate, then we are confident that is a success. It doesn't mean it's going to last forever. So for example, if you've had a root canal for like 10, 15 years, and now that tooth has to get extracted because it cracked or because that root canal failed after 10, 15 years, is it really a failure or is it a success? That's where there's some controversy. Because to me, if you've had that tooth for an extra 15 years, that means you bought 15 more years out of that tooth before it had to come out. But a lot of times a patient hears that they're never gonna have to get work done on this tooth again. And unfortunately, that's just not true. Sometimes it can be true. Sometimes you never need to get work done again after you do something, but it's just not guaranteed. And a lot of it really does depend on the patient's habits. Are they grinding their teeth? Are they brushing like they're supposed to? Are they listening to all the instructions? Are they going for their cleanings? But also part of it's on the technique, like how good is that dentist at that procedure? How many procedures have they done before? And is their technique the best? And a lot of times it also just depends on the situation. Like sometimes we are just throwing like a last ditch effort to save a tooth. Other times cases are way more predictable. So if something's more predictable, obviously it's gonna last longer. So in a nutshell, it really just depends on the situation. Hope that helped. Anyway, thank you guys for watching. I hope you liked that video. If you haven't already, hit that thumbs up button and subscribe to my channel. If you have any other questions about any of these topics or anything else, let me know in the description below. I've seen this weird trend recently where people are trying to grow their jaw with their thumbs. It's called thumb pulling. The way this works is exactly like it sounds. You take your two thumbs and you go on the inside of the roof of your mouth and you basically pull it and hold it there. The claim is that this can actually widen your palate or the roof of your mouth. Now, why on earth are people